video is going to cover the signs and symptoms of cirrhosis. There are so many signs and symptoms that your patient could exhibit as a result of having cirrhosis of the liver. So first, we're going to briefly go over what cirrhosis is, so you can have a basic understanding of how cirrhosis affects the liver. Afterwards, we'll briefly talk about the pathophysiology of cirrhosis because this is going to help us better understand why the signs and symptoms that we're going to talk about are appearing. And lastly, we will talk about the signs and symptoms seen in patients with cirrhosis, as well as compensated versus decompensated symptoms. So let's get started. So what is cirrhosis? Cirrhosis is a liver disorder in which cells in the liver become damaged, leading to long-term deterioration of the liver. There are four main types of cirrhosis. There is alcoholic, post-necrotic, biliary, and non-alcoholic steatohepatitis. Okay, now some pathophysiology. Let's talk about exactly what is happening in the liver with cirrhosis. As liver cells are irreversibly damaged in the cirrhotic liver, these cells are replaced with scar tissue. This scar tissue is non-functional, meaning that the area of the liver that is replaced with scar tissue will become dead or necrotic. As a result, blood channels in the liver become occluded, and the anatomy of the liver becomes distorted. And if you guys remember back to your A&P course, the overall principle of anatomy and physiology is structure dictates function. If the anatomy of the liver is distorted, its function is also distorted. So the liver will be unable to carry out its various functions, leading to things like disturbances in metabolism and digestion, blood coagulation defects, fluid and electrolyte imbalances, the impaired ability to metabolize hormones, as well as the impaired ability to detoxify chemicals. Also, cirrhosis can cause bile to drain into the intestine, so these clients may also experience fat malabsorption, as well as the inability to absorb fat-soluble vitamins. Signs and symptoms of cirrhosis can increase in severity as the disease progresses. Symptoms of cirrhosis may fall under compensated or decompensated liver cirrhosis. Compensated symptoms are usually less severe and more vague. As the disease progresses, it is then referred to as decompensated liver cirrhosis. Decompensated symptoms are very strong and do indicate liver failure. However, what we're going to do next is go over all of the symptoms associated with cirrhosis. Then we will discuss which symptoms classify as compensated and which symptoms fall under decompensated liver cirrhosis. So some general assessment findings seen in patients with cirrhosis are chronic fatigue, anorexia, dyspepsia, nausea, vomiting, diarrhea, or constipation. There's weight loss. Patients may report having white or clay-colored stools. And the stools come out this color as a result of having no bile in the GI tract. These clients may also have tea-colored urine, which is due to high concentrations of urochrome. Patients with cirrhosis tend to have an enlarged liver and an enlarged spleen, so their abdomen may appear to be distended. There may be complaints of abdominal discomfort and shortness of breath, which are both a result of the organs being compressed from the enlarged liver. Nosebleeds, easy bruising, and bleeding of the gums may also occur. The patient's skin may also be itchy from the accumulated bile salts. And ascites. Ascites is one of those advanced complications of cirrhosis and usually occurs as a result of liver dysfunction and obstruction of the portal vein. Cirrhosis may cause the intestinal flora to migrate to the peritoneum. So some of these clients do have peritonitis. The skin, the sclera, or oral mucous membranes will be wandiced. There may be edema of the legs and feet. Abdominal vessels may become dilated. This condition is also known as caput medusae. Gastric varices may also occur because remember we said earlier that cirrhosis may cause blood channels in the liver to become occluded. This is going to lead to blood vessel distension throughout the entire GI tract, but especially in the upper GI tract. And these vessels aren't intended for high pressure, so they are at risk for rupture and bleeding. Also, remember we said that the ability to metabolize hormones is impaired in cirrhosis. So, since the liver cannot metabolize estrogen completely, male patients with cirrhosis may have gynecomastia, which is enlargement of the breast. They may also have something called testicular atrophy. The patient with cirrhosis may have tiny spider-like vessels, as well as palmar erythema, which is when the palms of the hands turn a bright red color. These symptoms are also related to the hormone dysfunction taking place in the patient's body. Let's discuss some nutritional assessment findings in the client with cirrhosis. These clients may have impaired GI function, poor dietary intake, as well as trouble storing vitamins, especially vitamins A, C, and K. And having low vitamin K can be a major concern for those clients with bleeding disorders, because lack of vitamin K is going to lead to ineffective clotting. Now, finally, let's compare the assessment findings of compensated versus decompensated cirrhosis. As we said earlier, compensated symptoms are usually less severe. Compensated symptoms include intermittent mild fever, vascular spiders, palmar erythema, unexplained epistaxis, ankle edema, vague morning indigestion, flatulent dyspepsia, abdominal pain, a firm, enlarged liver, and enlargement of the spleen. The decompensated symptoms, which are those symptoms that indicate that the patient's liver has too much scarring, include ascites, jaundice, weakness, muscle wasting, weight loss. The fever is no longer intermittent, it becomes continuous, clubbing of the nails, purpura, which is a rash of purple spots. This is caused by their decreased platelet count. Other decompensated cirrhosis symptoms include spontaneous bruising, hypotension, epistaxis, sparse body hair, white nails, and gonadal atrophy. Okay, ladies and gents, that brings this video about signs and symptoms of cirrhosis to an end. I really hope this video was helpful. Please be sure to like this video, share, and subscribe. Remember to never give up, and as always, thanks for watching.